And Bruce.
I think Judy said unfortunately, so I guess the message is make it short. Well, you know, we can't close this meeting without thanking you, and without, as all of you said, let's make sure we do something about this, right? You spend a day thinking through these issues, and you know, there's so many great talks, panelists, conversations, ideas. My feeling is, how can we go home without trying to say what we can do next? That's the key issue. My feeling is that we should think about how we can make a difference. So many of you saw that during the preparation of the conference, we asked for your commitments, many of the organization, about what are you going to do about this? And in fact, this morning I had breakfast with 20-some stakeholders, leaders of organizations, and I asked, well, what are you committed to doing? So the good news is we actually have people writing in to tell us what they'll be doing. To me, it's a statement they're making of the commitment they're doing. So, so I want to show you a few of them. First of all, I want to show you that the list of people who's written in to say, you know, this report is great, this area is important, we are committed to do things, and this is the area we're going to commit ourselves to. And I think you can see this list, and many of you recognize yourself on this list. So let me just read you a few examples of this 46 formal statements. So the first one is American College of Surgeons. It says, the American College of Surgeons recognizes and affirms that the provision of high-quality palliative care for those with serious illness near end of life is a core value for surgeons of all specialty. We support the recommendations of IOM's report and pledge our commitment to the following areas: professional education and development, policies and payment systems to support high-quality end-of-life care, clinician-patient communication, advanced care planning. Powerful, right? And, you know, this is a formal letter to me, and I'm going to hold them to it. What do you think? Good, thank you. So the next one is from the National Coalition for Hospice and Palliative Care with support from, as you can see, the organization. It says the coalition and our members are committed to using the IOM report as the basis and rationale for numerous public policy positions, and to make the case that it is a national imperative to increase access to palliative care and hospice for everyone experiencing a serious advanced illness. Let's see a third one. This one is from Pew Charitable Trust. And of course, many of you recognize, I know you're still here, so thank you. It says, building on the foundation of this report and the work done by many groups and individuals over the years, the Pew Charitable Trust recently launched a new advocacy effort. The Improving End-of-Life Care Project seeks to advance policy that help people articulate their preferences for future treatment. When they can't speak for themselves, hold hospital and healthcare providers accountable for quality care, highlight innovative ways for providing care to seriously ill people and their families, and improve documentation of patients' preferences for their care as they reach the end of life. So, Stanford Center for Longevity is launching an effort to address recommendation 2 of the IOM report to identify the key unanswered questions about decisions that surround life-threatening illness and ways to improve decision quality. The project aims to identify critical turning points and contexts where individuals and loved ones can optimize decisions to match patients' goals. The project will cultivate ideas in an effort to support research and policies that help individuals manage life-threatening illness on their own terms and find ways to strategically communicate evidence-based guidelines across the nation. I'll just read you one last one. You can see this is so heartwarming and so exciting to see people willing to throw their weight behind this. The Alliance, National Alliance for Hispanic Health. The Alliance providing a statement on the recommendation that calls for an increased need for public education engagement of communities about advanced care planning and end-of-life care. We will work with funders to make this a priority. We feel this is of particular concern for Hispanic communities as the population of older Hispanics is expected to double in size over the next 2 decades. Hispanics often face language and cultural barriers as they navigate the health and social service systems. There's a lack of cultural proficient services, and there are few long-term care facilities that meet the needs of the growing population of Hispanic older adults. So there's so many others. I ask you who haven't sent a statement, please join the other IOM and the 46 other organizations making that commitment. Send us a note. We're going to collect all that together. You can see, in fact, it's www.iom.edu/end-of-life, and see the commitment statements and make a commitment to the email to, as you can see, to Laura DiStefano, who's one of our excellent staff, and she is going to put all that together, and we truly appreciate it. Now, so I mentioned before, the role in this has been made possible by anonymous donor. I met with a young group of we call Merzine fellows at lunchtime. I wasn't able to join you. We had this great talk about policy. And someone says, are you not worried about anonymous donor? Is that person, in fact, shaping the whatever? I just want to assure you that anonymous donor had nothing to do with, Phil can tell you. He doesn't even know who that person is. And in fact, I think it is people like you who want to do the right thing to say, we'll provide you with those resources, and I'm going to step back and make sure, and I know that things will be done right. And so we want to really thank that person. And that person not only helped us with this, but that foundation and that person helped us this effort. And I said the other day to my team, what happens after this meeting? I want to make sure more things happen, not just another meeting. So this conference is to get people in the same room, to build this community of people. We know we're not an advocacy organization. Some of you are. We want to work with you to create the venue for you to be able to do your job because it's the right thing to do. Also, we're developing a community event template. This template will help promote the end-of-life conversation among individuals, their loved ones, and care providers. We will fund, IOM at our own funds, and facilitate several of these events in various locations around the country this spring and summer 2015 as we test and refine this template. Once they complete, this template will be made available to be free downloaded on the IOM website by anybody so it can be used broadly. That's another sustainable deliverable that we can do. You know, we know the end-of-life is not always a popular topic, but we need to get on to the radar of all individuals and families. We might not want to have advanced care planning conversations, but we must have them. And to get the message out there, we are going to develop a radio and television public service announcement to be distributed around the country, starting in April 2015. And it's leading up all the way to the National Healthcare Decision Day. So that's another tool we're working on. Now, we have limited resources, but we want to put it to maximum use. And as I said, we're going to continue to use our own resources if, in fact, the dissemination funds go out to keep this going. So this PSA, I want to share that with you today so you have a sneak preview. Nobody's seen it yet, okay? And we'd love to get your comments. Take 30 seconds. Even Judy says, unfortunate. Okay, 30 seconds to see this. So actually, you notice at the end of PSA, it directs people to visit the IOM website, which lists resources and tools to assist people in having conversations and planning for the IOM, for the end-of-life issue. So again, I want you to check that page out. So let's take a look at the PSA first. But it is, what I said, is iom.edu/theconversation. Sounds like a movie, but it's important. And the slide will show you 2 URLs. So do we have that on?
Millions of conversations will happen today, but there's one that few of us have had. A conversation about the care we want when we're seriously ill or nearing the end of life. Sharing your wishes with friends, family, and care providers now and as life changes may improve quality of life at the end of life, both for you and for the ones you love. This conversation may be difficult, but wouldn't you rather have it now, before a crisis? It's time to have the conversation. A message from the Institute of Medicine.
Thank you. So, as I said, we will launch this starting in April and run it through until the National Healthcare Decision Day, and hopefully this will be a public service announcement on radio and as well as on television. And then also we want to call your attention to, as you probably saw, a product that we developed, a USB card that you might have not have seen. If not, make sure you pick them up on the way, that has all these different resources and a link to the video PSA, and the card contains the entire IOM report, of course. And also, we developed more communication material, possibly a state-level policy event or webinar series. Look out for them. We want your help, and spread the word. And let us know how we can help you in your work. Just reach out to us. I know that what's strength about our organization is we have tremendous credibility, respect, and so we want to use that to help to advance the right cause with all of you. So that's it. Thanks for coming. Thank you. We look forward to this journey together with all of you. And don't forget, let's make sure we do something about this. By the way, I hope that I'll probably get together for those people who make the pledges, maybe 6 months to a year from now, to sit down with them and to see, I was telling Phil Pizzo, that to see where we are. And if you make the pledge, as I said, I want to see something happen to it. Thank you.